Welcome to the Capital Spine and Pain Center's Patient Video Series. Our board-certified physicians are committed to helping you better understand your condition and the non-surgical treatment options that are available at one of our many clinics throughout the Washington, D.C. area. We've created this series of patient videos to help you find the answers to your important questions about acute and chronic pain.
Spinal cord stimulation is the use of electrical energy applied at the spinal level in order to reduce pain signals. In a lot of ways, electrical current has been used for centuries, even dating back as far as 40 AD, using torpedo fish to treat painful conditions such as gout. And even Ben Franklin in the 1770s used to use static currents to treat gouty conditions that he referred to as Franklinism. Spinal cord stimulation works similar to the way that traffic in any four-lane highway would work. If there's 4 lanes of traffic wide open, then all cars traveling those lanes can travel without restriction. If, however, we close those lanes down due to a detour construction to just 1 lane, then 4 lanes of cars merge together and travel through one at a time. This is similar to the way the pain signal is competing with the electrical stimulus we're providing to get to the brain. And thus much of that painful signal that's recurrently limiting your lifestyle may be blocked at the spinal cord level and canceled or reduced. Permanent units are placed much like pacemakers are placed. It is a small surgical procedure that perhaps at most requires a one-night stay in the hospital. It's not nearly as complicated as a typical spinal procedure in that the recovery is much shorter. There is a small battery that's permanently implanted like a pacemaker, often just above the belt in the flank on either side in a comfortable position, so that really nobody would even know that you have this technology. The typical patient that comes to capital spine and pain centers that might be a good candidate for neuromodulation or spinal cord stimulation are patients often that have persistent pain after surgical procedures. Often I have to explain to patients that while you may have removed the pressure on the nerve root surgically, the damage may be inherently done. So in those patients, pursuing something in the form of spinal cord stimulation or dorsal column stimulation may be a way to electrically bypass or at least suppress the painful sensation that's in the arm or leg. Really, there's very limited impact in terms of function and activities that you can participate in with a permanent unit. One of the few limitations is scuba diving beyond 40 feet, heavy welding and operating a welding equipment, but aside from that, most patients can participate in any of their hobbies and/or employment activities without limitation. The risks associated with a spinal cord stimulation trial are no different than any other injection performed at the spinal level. They're really any injection that's performed under X-ray guidance is routinely fairly safe. While we have to make sure patients are not on any anticoagulants such as Plavix or Coumadin, other than that, the risk of infection and/or bleeding are dramatically low. The size of the needles used are not much different than those used to perform a typical epidural, and with such a reduced needle size and the ability to guide it under X-ray guidance in the office, patients can undergo a trial literally within 5 to 10 minutes.
For more information about non-surgical solutions for pain relief, call us at 703-914-8000 or visit our website at www.treatingpain.com.